Hello, everyone. Welcome to the Gifts of Hope 2020. We are so glad to have you with us today. My name is Greg Delaney. Now, I will be your MC, your master of ceremonies, if you will. And just to give you a little background on me, I am a Colorado native, I'm a poet, and an entrepreneur. But more importantly, I am an everyday person. And why mental health is important to me are for the simple reasons like everyone else. I deal with it day to day in my personal life, as well as family. Now, we have an exciting program for you today. The first half will be a journey through the ways in which Mental Health Center of Denver has been and will continue to be limitless. Now, let's repeat that word one more time, limitless. During the second half, you'll be able to hear more of our experts in a breakout session on a few topics that are top of the mind for people these days. Take a look at our virtual tour. Look at our virtual program below for the full list. While you're looking at the program, I'd like to give you the lay of the land for our virtual experience today. You've already seen the program right below me. Now to your right, you'll find a donation form, which you can complete at any time during this whole time together. Returning to where you see me, you could use that chat by clicking that icon at the bottom of this window. Now I'd like to say a few thank yous. Thank you to the sponsors, our title sponsors, Citywide Banks, our presenting sponsor, Optum, our Innovator level sponsors, More Events, the Rotary Club of Denver Southeast, and New DESIG, and our collaborator and partner level sponsors. Thank you to our host committee, individuals who are widely known and well respected in this community and who have helped spread the word about this event. Thanks to our Gift of Hope Advisory Group, consisting of staff from across the organization who contributed their time and talent to these stories which we're going to share with you today. And finally, a very special thank you to our board of directors, who are not only tireless champions for mental health, but leaders of the future of well-being. Now, I would like to introduce Dr. Carl Clark, President and CEO of Mental Health Center of Denver. Welcome, Dr. Clark.
Greg, thank you for the introduction. Welcome, everyone. We're doing things differently. Mark is behind the camera, and we're staying a healthy distance away. The pandemic has impacted the well-being of all of us. The demand for our services are increasing. Limitless is an interesting concept. So many things in our world have limits. The pandemics required us to limit many aspects of our lives. What makes us uniquely human is our limitless imaginations and our ability to come together and create things that never existed before. There are no limits to our creativity in making sure people have what they need to thrive, figuring out how to get people what they need in a safe and healthy way. And what each of us have in abundance is love. Love is limitless. We're looking forward to sharing with you more about our STAR program, and make sure to stick around for some exciting breakout sessions for the second half. First, we want to share with you some of the ways we have been limitless over the past few months.
So at the Mental Health Center of Denver, innovation is part of our culture. It's what we do, it's how we think about things.
Majority of our services were performed in person. At that time, we were considering moving to telehealth and had begun doing some investigative work in order to prepare for that shift. Telehealth is providing services through a medium that is not in person. So specifically, when we think telehealth, we're thinking about providing services via video conferencing. And then COVID hit, and at that point we realized that telehealth was upon us and we had no choice but to move there. So we worked very closely with our operations team to figure out workflows where our clinicians could provide services remotely, either via phone or preferably via video to the people we serve.
Fortunately, the Information Systems Group was creating an infrastructure that could move into the future. So when COVID came, we were right there and ready to go. But the people we were serving weren't ready. What happens is we ran right into the digital divide. And the digital divide is basically the people who can afford devices and internet access and those who can't. So now we have to figure out a way, it's like, yes, we have this service available, but how do we get it to people? What is the access? So one thing we did is we paired up with PCs for People. And PCs for People is a nonprofit organization that provides devices, computers, and low-cost internet to low-income people and nonprofits.
We stood up kiosks at certain facilities so that people who didn't have access to internet or didn't have access to a smartphone or a computer were able to come to the building in person and still receive telehealth services safely from their provider.
To make the commute into our clinic, some of the people we serve would have had to take half a day, a full day off of work. They would have had to find childcare for their little ones or for their loved ones. And that is a big burden. With telehealth, we're just a click away.
So before COVID, we had one therapist who was doing telehealth services. After COVID, and within 3 days, we had every therapist and clinician doing telehealth services.
Now I can see a much larger proportion of the folks who are scheduled because it's so much easier for them.
Mental Health Center of Denver has always prided itself on being very innovative and forward-thinking, and so we're always looking for ways in which to engage our audience in a different way. We are working on developing our own mobile application that's available on both Android and iOS. This is going to allow the people we serve to have immediate access to their appointments so that they can easily connect with their care providers. But we're also looking at broadening this into what is termed the digital front door.
Now that we are fully in telehealth and the digital experience is there, our digital front door is a way to reach out to many more people. We're increasing access, we're increasing engagement because people now who may not have had the opportunity to participate in their mental health care now can.
I hope in the future that telehealth continues. I think the feedback I've gotten from the people we serve is that they love telehealth. They love the ease, the convenience of it. And I think telehealth is a door that once it's open, I don't think can be fully shut. I think it offers a viable alternative to traditional care.
The pharmacy supplies medications to the people we serve, both as a walk-in and the injectables that they receive on the nursing floors, as well as delivering the meds to the assisted living facilities. After COVID, we no longer wanted people to come into the clinics to keep people safe. So the pharmacy had to reimagine what we were doing. And we had to figure out a way to get the medications to the people we serve while keeping them safe and while keeping ourselves safe. So what we landed on was delivering medications to everyone we serve. And within a week, we were delivering all of our medications to the people we serve. And we've been doing COVID testing that's open to the public, open to the patients we serve, open to our staff, and we've been doing that. And on top of that, now we have flu clinics and flu season. So it hasn't stopped for the pharmacy, and we have to be very strategic in how we use our resources for that. The pharmacy team has done an amazing job collaborating, adapting, figuring this out. I couldn't be more proud of them.
We help people reach their goals, whether that's going back to work, going to school, just working on their own wellness. We're here to help people pursue their wishes, hopes, and dreams. The services that we provide at To Succeed are To Succeed in Education, To Succeed in Employment, and then also our peer services. Peer support services here at To Succeed help people get integrated into their communities. In To Succeed in Education, we help people either go back to school, whether that means higher education, pursuing their GED, and just learning more to progress their lives forward.
The pandemic hits, and we have to learn as a company, company-wide, how to do online learning. How are you going to do that with culinary? when everything is in person, hands-on, cutting, doing all that. So what Drake and I, my co-supervisor, did is we came together, we collaborated on curriculum that can be online based, where we can still show videos. So we came up with the professional chef. It's what a large company or culinary school would use. So every student still got those accredited hours, Monday, Tuesday, Wednesday, Thursday, Friday. It was really hard at first because we thought we were gonna lose a lot of students, but I'm really happy to say that we have not lost a student, and we actually had our final graduation on the 28th. I believe we have 13 full graduates from everything that we did this year.
Now we're at a point where To Succeed in Education is offering over 75 classes online for the people that we serve. With To Succeed in Employment, we have 14 employment specialists who help people go out in the community to pursue employment.
They had a lot of things that they could offer, such as employment opportunities, education services. Completing the vocational training program here at To Succeed allowed me motivation, wanting to apply for my graduate work in organizational management. I just feel blessed to work with To Succeed and being able to set new goals and reach new heights.
Now, we're going to be diving into our STAR program, which you may have heard about on local, national, or even international news. Now, as we will hear shortly, STAR is a program in which mental health clinicians and EMT response to certain emergency calls, rather than law enforcement.
The STAR program stands for Support Team Assisted Response, and it is based off of the CAHOOTS model in Eugene, Oregon, which has been in existence for about 30 years, that looks at diverting low acuity, low risk 911 calls to a mental health clinician paramedic team. So really looking at sending the right response in Denver when someone calls 911 versus a one-size-fits-all response.
So historically what happens is someone calls 911 and you have one option, and that is police responding to that call. What Denver's really kind of created with STAR is the ability for a triage to take place at the 911 center that says, is this law enforcement in nature? Is there a legal component? And if there's not, let's send a social worker, let's send a paramedic, and let's see if we can't manage that situation without having to introduce a badge to the situation.
People call 911 in Denver for an array of different reasons. It's not always something that involves risk or a criminal element.
That's really the intent of STAR, is sending the right response to a crisis. What we recognize pretty quick with this is that there are calls consistently coming across 911 that don't have a law enforcement component. Historically, law enforcement has gone to those, and we just question, maybe we need to come up with a different alternative. Enter STAR, and that's the ability for us to actually send the right response, which is a mental health licensed clinician with a paramedic to a call to triage it and determine, how do we get this person long-term support? How do we get them through this crisis right now and onto that road of recovery moving forward, without police having to be part of that situation. I think this idea, or at least starting to branch out on this idea, really was the Mental Health Center of Denver, just with our co-responder program, having understanding of how the system works and what tweaks we could make to it. It was the Denver Police Department recognizing that they wanted to have a different approach to how they engage the community, and recognizing pretty honestly that they didn't need to be on some of these calls. Denver Health has actually been a tremendous partner in this, in that they immediately raised their hand and said, we want to be able to provide the medical lens attached with this program.
Being paired with the Denver Health paramedic has been an incredibly positive experience. I think that we've quickly realized that this was a very valuable partnership. When the medic and I show up on scene, we have all of our bases covered as far as physical health and behavioral health.
I think what we realized pretty quick is that we are coming across to the community in a much different fashion. I tend to wear a t-shirt, I tend to wear jeans, and I just look like some guy holding water and a bag of pretzels and saying, can I just have a conversation with you? And just kind of coming across unassuming. It puts people off because they're so used to a different dynamic of how they're engaged. And I think this allows us to kind of take the fear out of that interaction and recognize that we're actually here to help manage whatever you're going through in that moment. I think that's what really makes the Star Van creative and unique, is that we're a very fancy item inside a very unassuming box. We're also here to kind of figure out the long-term solution, whether that be a transport to someplace.
We have responded to individuals who are experiencing suicidal ideation but are not in imminent risk.
Connection to previous providers.
We've connected people to day shelters, to the walk-in crisis center.
Being able to problem solve how someone gets medication, being able to just be a listening ear for someone.
Letting them know that STAR is a supportive resource, and when they see the STAR van pull up, they can be sure that two non-judgmental, client-centered, supportive people who are willing to listen are going to get out of that van. I think the STAR program has been very successful so far. One, I mean, we're out there meeting the needs of our community.
We're really gauging this program's success on the ability for people to access services immediately, especially at their request. The other one is how many times can we keep law enforcement doing law enforcement-based stuff and keep them off of having to be a part of these calls.
So if the police can get there and say, this issue doesn't really require a police officer, and radio the STAR van, and we come over and that officer can leave and go make it to a robbery call or a domestic violence call, then I think that that's an incredible success.
To date, we've been on 450 calls. We haven't had to call police for backup once. We've been able to manage everything on scene and really be able to get people to where they need to get to without having to involve law enforcement.
We're also able to divert people away from the ER when they don't need it. If an individual with a, kind of low-level health concern is brought to the emergency room, they're just really going to be stabilized and discharged. And that's where we see that cycling happen, where people are consistently in and out of ERs because we're not dealing with the root cause of the issue. So the paramedic and I can sort of triage and assess and really make sure that they're getting the appropriate resources instead of very high levels of care that are oftentimes very expensive.
And I think that's the thing that we, really try to imprint, is how do we engage people in a different way. It's being present with someone, it's being there to be able to provide support and say, whatever it is you need right now, I'm going to work right now in the moment to make sure that you're feeling supported.
I became familiar with the STAR program because in the area that I'm from, I found myself homeless. I had my service animal with me, and I found myself with nowhere to go, and I greyhounded here to Colorado, and I reached out to a individual who was doing volunteer work, and they placed me in a hotel. They agreed to put me in a trauma center for 5 days, and back to the hotel. I had been in the hotel for a month. And the time came for me to come to 2nd Street. The van drives up, the white van. Their persona, their mannerism bespoke of individuals who were coming to help me and not harm me. They personally walked the 4 flights of stairs and went and retrieved the rest of my belongings, brought them to the van. They helped me and my service animal. Within a minute, even in the ride, I felt a sense of, okay, everything is going to be okay now. If I was in a situation where I was on the street, if they were called, I would be more likely to talk to them. Nothing will bring compliance out of an individual who is in a state of panic as does a sense of trust. This is a miracle, and this needs to be implemented all over the United States. I am alive because of the STAR program, also because of MHCD, with optimism that I had lost, and it's coming back.
So I'd like to thank those of you that have been coming to this event for many years, coming in a new way this year, and I'd like to also thank the people that are joining us for the first time to learn about how you can support the things that we do. So one of our leaders, Rick Doherty, our Vice President of Development, is the creative force behind Gifts of Hope. He and his team have put together all of the events and pivoted to put this one together in a virtual way. Many of you know Rick, and Rick will be retiring in November. So Rick, I want to say thank you on behalf of all of us for this great work. Any kind of disaster that happens is one of those things where we want to come together as human beings to support one another. This COVID-19 pandemic has required us to be physically distanced from one another. It's the opposite of what we feel like we want to do. This has been hard on all of us. It's impacted the well-being of everyone. Our routines have been disrupted. Our ways of doing things have had to change. We experience grief in times like these. Some have lost loved ones. Others have felt loneliness and isolation. We see all the stages of grief: shock, denial, anger, sadness, bargaining, and yes, acceptance and hope as people figure out how to deal with this stress. This is stressful. Now, stress has three components. We have a physical reaction. We would avoid it if we could. And we don't feel like we have any control over what is happening. For me, in the beginning, going to the grocery store was stressful. I did learn how to keep myself safe, and the stress went down. I wore a mask. I don't touch my face. I stay 6 feet away from people, and I wash my hands. There are two types of stress: the ones that we can get control over, and the others are hypothetical stresses. Those are the things that we really don't have any control over, but we can yet do something about them. A hypothetical stress would be, what if I die? What if a loved one dies? We can think about what we would want to happen in that situation that we might not have any control over. I recommend that people actually pick a time of day of when they're going to be stressed. I know that sounds kind of funny, but if you pick a time of day and you say, that's when I'm going to think about my stresses, it allows you and your body to not think about that stress 24/7. Our amygdala is the part of our brain that is where stress comes from. It's our fight and flight response. And it's our body's way of telling us that something important to us is not going right. So, when you're feeling stressed, the best thing you can do is acknowledge, I feel stressed. That will move the stress from your reactive part of the brain to your frontal lobes, where you can problem solve. And you can start to figure out, what is this thing that's stressing me, and how can I get control over that? So the stress for us was, how do we deliver services in the context of a pandemic? So we made the big pivot, and we shifted most of our services to telehealth. So we're seeing people on screen like you're seeing me right now. Not all of our services can be done in a telehealth way. We have services like our primary care clinic, our pharmacy, our co-responders, our residential services. Those are services where we had to learn how to use the personal protective equipment to keep the people that we serve safe and our staff safe. So I'm happy to say that we have not had any COVID infections in any of our residential services. At the Mental Health Center of Denver, we know and believe that everyone wants to be great, that each one of you and the people we serve have strengths, things you do well. We leverage those strengths to help people have the life that they want to have. Each person is unique and in unique circumstances, so we listen deeply to people to co-create a pathway to improve that person's well-being. I was trying to set a good example for my staff by taking a vacation. I have been encouraging people to take breaks. And on my vacation, I turned everything off, all my media, everything. And then I got a text close to the end of my vacation that Denver had a curfew, and I didn't know what it was about. I quickly found out about the murder of George Floyd, and all of the things that had been happening after that. When I got to work on that Monday, we declared a disaster around equity and racial justice. Our crisis management team is looking at every aspect of our organization on how we can end anti-Black racism. Our organization developed in the context of white privilege, as other organizations in our country. So it only makes sense that we might have things that we need to change to make sure people have the opportunities that they need. We're continuing to adapt. In December, we will open the Behavioral Health Solutions Center. That's a crisis stabilization unit where first responders can take people that are dealing with a mental health issue, or if they have a substance misuse disorder, they can go there to get started on their pathway to recovering. We also have had the experience that some of the folks that we see have had some trouble with either their computers or their iPads or their phones in connecting with our telehealth services. We have lots of support around them, and yet we wanted an easier way for people to get access to care. So we've invented an app. It's our digital front door where people can make appointments, and when their appointment time comes, all they have to do is click on the appointment and their therapist will be on the other side. So all these things that we're doing, we think are a bit beyond what people typically think of when they think of a mental health center. So what has been happening to our brand, and what is the core of what we're doing? We believe everything that we do powers the pursuit of well-being. We want to remove barriers to services and create pathways for access to care that never existed before. So our compassion for helping people is limitless. Our resources are not. Your donations and support fund our human-centered design approach to innovation and creating the next big thing. Thank you.
Thanks, everyone, for joining us for the Gifts of Hope event. We're so glad to have you here with us. And Carl, thanks to you and your team for sharing some of the great ways the Mental Health Center of Denver is responding to the new needs of our community during these dynamic times. I'm Barb Yondorf, a board member of the Mental Health Center for the past 4 years. The staff of this center understand that people need mental health and other related services when and where they need it. As you've heard, this includes such things as telehealth, medication delivery, job-seeking supports, and on-site emergency assistance in certain situations. I'm proud to be a part of an organization that provides whole person, community-based care. I've always been inspired by the Mental Health Center's work. Since joining the board, I've developed a deep attachment to the organization, partly because of their commitment to ensuring access to mental health and well-being services for everyone in our community. I know firsthand how important it is to get the support needed to deal with mental health issues. Since I was a teenager, I experienced episodes of deep depression and extreme anxiety that often kept me up for as many as 24 hours at a time. I did not seek help. Get your act together, I told myself. Things got so bad that twice I left fairly high-powered jobs. I didn't tell anybody why. Among other things, I feared the stigma. Finally, at the insistence of my family, I sought care. About 10 years ago, I was diagnosed with bipolar disorder. I got the therapy and meds I needed and experienced joy for the first time in many years. Others deserve access to the care and supports I was privileged to get, that the Mental Health Center of Denver provides broadly to our community. I know the value. As a proud participant in the center's work, I'm asking you to help us grow into an even stronger resource for our community by making a financial investment in our programs. If you look to the right-hand side of your screen, you'll see an online donation form. During the program, you heard about a number of ways the Mental Health Center is responding to the most pressing issues we see in our community today. You'll have a chance to hear more from our experts about some of these, as well as others in the breakout sessions that follow. So scroll through the form to see opportunities to designate your giving in areas most important to you. Areas that you can designate that will make a difference in the life of our community today include children, teens, and youth, technology and digital access, advancing social justice, employment and education, or areas of greatest impact. Whatever gift you make today, we're grateful to you on behalf of the people and communities we serve. Together, we're powering the pursuit of well-being. Thank you for your generosity. Now, back to you, Greg.
Thank you, Barb. I would like to reiterate the invitation to be a part of the work of Mental Health Center of Denver using this form to the right. We have covered a lot of ground so far. We have learned about telehealth, technology access, medication delivery, and education and employment during this pandemic. We've seen a new approach to meeting the needs of the community through the STAR program, and we have heard from a few truly remarkable people about their journey with well-being. Now it's time to transition to the breakout session, part of our program. Below, you will see a list of session topics. Just click the link next to the session you would like to join and you'll be taken right there to hear directly from experts in the field. Thank you again for joining us today. Remember to take care.